Welcome to the video on non-sync condition in resolution testing. It will be a short video to understand regarding the sync and non-sync conditions, and this video will give you information regarding the non-sync conditions, why these are mm, important to understand for the non-sync and sync condition, and how these will impact. I have made many videos on the resolution. I request you and suggest you to go through those videos, but still I want to make, and I am making videos because resolution is a very vast topic, very big topic, and if we keep on learning, we get some new information every time. Non-sync condition in the dissolution testing, first we need to check what is the sync condition. So if your media and media volume can dissolve at least 3 times of the dose of the formulation, or you can say the highest strength dose, then you can say that the dissolution media is meeting the sync requirements. Now coming to the non-sync conditions, when the drug concentration in the dissolution medium approaches or it reaches the solubility limit, then it is called as non-sync condition. That means your medium is getting saturated. The result of this non-sync condition may be that the further dissolution will slow down because of the saturation of the medium. Contrast with the sync condition. Sync is the condition or media volume that can dissolve the 3 times of the dose. In other words, sync means dissolved drug concentration is not reaching to the saturation. It is 1/3 of the saturation solubility. And non-sync condition is the dissolved concentration more than the saturation solubility, or it is reaching to the saturation solubility. So if you require that the dissolution should show exact formulation variables and it is not limited by the solubility, then sync conditions are required. And that is the reason the sync conditions are recommended. But sync conditions are not mandatory. You can justify the non-sync condition also, but you should demonstrate that you are not able to meet the sync conditions. Why to use non-sync conditions? Sometimes non-sync conditions can be important, can give you more information. So why we can use or we should use sometimes the non-sync conditions to simulate real in vivo GI tract conditions for the poorly soluble drugs. BCS class 2 and 4 drugs are low soluble or poorly soluble, and it is very difficult to meet the sync conditions every time, and especially when the dose is high, that time we cannot achieve the sync condition in full. So non-sync conditions can be used. Then non-sync conditions can detect formulation differences masked under the sync conditions. It can also help you to evaluate the precipitation risk in supersaturated systems. Support the biopredictive dissolution for BCS class 2 and 4 drugs. And it can help in formulation optimization for solubility limited products. So you can consider it as a worst case scenario for your dissolution testing and screening of the formulations. You can go for the non-sync conditions to optimize the formulation, to screen the formulation for bioequivalence batches or clinical batches, and then you can try to get the sync conditions as well. But whenever you are going to file the product, always have the data to demonstrate that the sync conditions are meeting. Sometimes it is not possible to meet the sync conditions. That time non-sync conditions can be used. Key considerations for medium selection: polymorphic changes, precipitation monitoring will be there, data interpretation, and relevance of the bioavailability. So volume and composition should be selected such that it will not lead to the saturation. Polymorphic changes, monitor possible transformations, and monitor the precipitation. You can do visual observation, and also you can check the precipitation through analytical methods. Expect the early plateau in dissolution profile. If your dissolution is not getting the complete extent more than 80% or 90%, that means some precipitation is there, some solubility issues are there. Then closer correlation for the poorly soluble APIs can be made through the dissolution testing in non-sink conditions, and you can relate it to the bioavailability. Non-sink testing complements standard QC dissolution, provides valuable insights for the drug development and biopharmaceutics, especially useful for the poorly soluble and lipophilic drugs, and it should be used strategically in the early development and the formulation optimization. Sink condition is required, but it is not mandatory. Some of the formulations are tested in the non-sink conditions. Sometimes you cannot get the 3x solubility, but you can get 1x or 1.5x or 2x solubility. So if it is below 3x solubility, the condition will be non-sink, but still you can use it. This video will help you to understand non-sink conditions. I have made other video also in details like sink and non-sink condition. You can go through that video. This is a short video to let you know regarding the non-sink conditions. Thank you for watching the video.